Okay, and without further ado, I'll go ahead and turn it over to Mrs. Weller to get us started for today.
Thank you so much, Candace. Good morning, everyone, and welcome to the 2022 Annual Community Health Improvement Plan Review Meeting. Thank you for being here with us today. My name is Karen Weller, and I am the Director of the Office of Community Health and Planning at the Florida Department of Health in Miami-Dade County. During our meeting today, we will share a high-level overview on the Mobilizing for Action through Planning and Partnership, also known as the MAP process. We will highlight new updates provided by the National Association of County and City Health Officials, also known as NACHO. This will include updates on the framework, specifically the assessments which guides our community health plans process. We will also provide a comprehensive overview of the status of the Miami-Dade County Community Health Improvement Plan, also known as our CHIP. You will have the opportunity to provide input for process improvement for our various CHIP objectives. Finally, we are proud to share updates on the establishment of the Florida Department of Health in Miami-Dade County's Health Equity Office. This office is using innovative approaches to address health equity and identified barriers for underserved and minority communities in Miami-Dade. Later in this meeting, you will be provided with updates on this office, which will also include the work of the CDC COVID-19 and Health Equity Grant and the Health Equity Advisory Committee. Now, before we begin, I have a few housekeeping items for today. All participants are in view and listen only mode. You can type your questions in the chat box, which will be monitored to assist with any questions you may have throughout the event. The meeting agenda has been shared in the chat box with all participants. Finally, if you are experiencing any technical issues or need support, please contact Imani Morgan at imani.morgan2@floridahealth.gov. We have also included this information in the chat box. Thank you once again for being here with us today. Now I would like to introduce Dr. Villalta. Yesenia Villalta is currently the Administrator and Health Officer for the Florida Department of Health in Miami-Dade County. She has been with the department since 2005, where she provides oversight to public health activities for the department. Dr. Villalta is an advanced practice registered nurse and has been in the nursing field for over 20 years. She is a three-time graduate from the University of Miami School of Nursing, where she earned both her bachelor's and master's of science in nursing, as well as a doctor of nursing practice degree. Dr. Villalta is focused on public health issues, clinical practice, and quality improvement and performance management. She has also been actively involved in the agency's performance and quality journey by chairing and leading various work groups and quality improvement projects, taking lead roles in public health accreditation and Sterling Performance Excellence site visits. She also participates in various community and nursing advisory boards. Please join me in welcoming Dr. Villalta.
Thank you so much, Ms. Weller, for that warm introduction. So good morning, everyone. Welcome, and thank you for joining us for this annual CHIP community meeting. I'm so glad you all are here today for this strategic meeting and important community presentation. The mission of the Florida Department of Health in Miami-Dade County is to protect, promote, and improve the health of all people in Florida through integrated state, county, and community efforts. At the Florida Department of Health in Miami-Dade County, population health is our priority. Since the last time we met, we launched a call to action for key community stakeholders and community partners to apply to become a member of the Health Equity Office Advisory Committee. We are happy to share this committee was launched in December 2021. The committee has a total of 24 organizations who are working together to address health equity through the adoption of sustainable policies, systems, and environmental changes to address the social determinants of health. These are the factors and conditions in the environments where people are born, they live, learn, work, play, worship, and age that affect a wide range of health, functioning, and quality of life outcomes and risk. The social determinants of health can be grouped into 5 domains. The committee's action plan works to address these areas, and they include economic stability. This domain focuses on the connection between the financial resources people have and their health. We have education access and quality. This domain highlights the connection of education to health and well-being. Healthcare access and quality. This domain highlights the connection between people's access to and understanding of health services. Neighborhood and built environment. This domain focuses on the connection between where a person lives and their well-being. Social and community context. This domain emphasizes the connection and focuses on helping people get the social support they need in the places where they live, work, learn, and play. Last year, the Department of Health in Miami-Dade County was also awarded the National Initiative to Address COVID-19 Health Disparities among populations at high risk and underserved, including racial and ethnic minority populations and rural communities, grant by the Center for Disease Control and Prevention. We have been working with a total of 36 organizations to address these health disparities. Later today, we'll be highlighting these efforts through a high-level overview. Due to DOH Miami-Dade bearing the responsibility for protecting the health of the public, the staff developed the Community Health Improvement Plan. As we know, it's called the CHIP. And this was done in partnership with local community members and organizations. DOH Miami-Dade staff is responsible for the ongoing monitoring of the CHIP, which plays a vital role in carrying out our core values. The coordinated approach we take to improve health has resulted in an interactive, vibrant, and collaborative health system. DOH Miami-Dade is only one part of the public health system. Other agencies, non-governmental organizations, we have institutions and informal associations play critical roles in creating conditions in which people can be healthy. We understand that leading residents to better health requires a multidisciplinary approach, including the collective strength of individuals, communities, and various social institutions working together to improve health. The current Miami-Dade County Community CHIP was developed in 2019 by a broadly defined public health system, which includes the public, private, and voluntary entities that contribute to the health and well-being of the residents of Florida. The CHIP is designed to promote collaboration, coordination, and efficiency. The plan identifies 6 strategic public health priorities, areas that were chosen by the community, each with their own goals and objectives that result in positive health outcomes. Some of the health outcomes are captured through data sources, such as the US Census, the Healthy People 2030, Florida Health Charts, and Miami Matters. These data sources help us examine further issues such as risk factors for diseases, illness, mortality, social, economic, and environmental conditions, inequities in health, and quality of life. It highlights the many activities within the public health network that contribute to community health improvements, which address the most pressing concerns facing our community. Most of us know that in order for us to stay healthy, we need to do many things, like eat a balanced, nutritious diet, participate in daily physical activities, receive our recommended immunizations, avoid smoking, and visit a healthcare provider on an annual basis for our yearly screenings, or even when we're sick. What many do not know is that our health is also shaped by our social, economic, and environmental factors in which we live, such as the quality of our schooling, the cleanliness of our water, our food, air, and the economy in which we work in, and our community resources which we have access to. These, again, are referred to as our social determinants of health. As we go forward with the CHIP, it is important to address the conditions that contribute to our health, rather than only treating medical conditions after they occur. Our CHIP is the performance measurement tool used to determine our progress in improving our community health. We've developed this CHIP annual report to evaluate the current progress and status of each indicator and to monitor its role in our community. With this CHIP, we envision a community where health equity is achieved, care is accessible, chronic disease is prevented, maternal child health is improved, injuries are reduced, and communicable diseases and emergent threats are treated and prepared for. With more than 120 indicators, the CHIP brings us closer to a Miami-Dade County that we envision. We are proud to share that earlier this year, we submitted to the state our community health assessment and our community health improvement plan, and we received a rating of 100%. This success of this achievement is vital, and it's a reflection of all of you, our community partners. We are all part of this community. Your valued contributions have allowed us to move forward. We would not be here today without your efforts. Let's work to Miami-Dade County be the healthiest county it can be. Finally, before we proceed through the rest of today's activities, I want to take some time to especially acknowledge Christopher Benjamin, our state representative of District 107, Florida House of Representatives, Sandy Sears, our health advisor to the Congresswoman Federica Wilson, and Ms. Susan Holtzman from Miami-Dade County Office of the Mayor. Thank you so much for being here with us today. I will now turn it over to Ms. Candace Schotten-Lower, who will provide an overview of the community health plans and development. Thank you all. Have a wonderful day.
Thank you so much, Dr. Vialta, for that warm introduction and your leadership and commitment to public health. And also thank you to all of our community partners for being here today with us and who have also helped us advance our shared goals. So now we're going to get into what is the MAP process. And so the MAP process is the mobilizing for action through planning and partnerships, which can also be referred to as the MAP process. It's a community driven strategic planning process used for improving community health by really identifying the strategic issues from our community assessments that we've conducted, and also using the community concerns and issues to help set the priorities and implement evidence based initiatives to advance health. This is also a process facilitated by public health leaders. The framework helps communities apply strategic thinking to prioritize public health issues, as well as identify resources to address them. And MAP is not just an agency focused assessment, as mentioned, it's really an interactive and dynamic process that can improve the efficiency, effectiveness, and ultimately the performance of our public health systems. It's also a national evidence based process that has been created by the National Association of County and City Health Officials. And today I'm going to highlight and provide to you some of those updates that NACHO has provided and is currently revising this process to really address health equity and the social determinants of health, which are the factors that influence our health and are at the forefront of all of our community assessments going forward. So next up, the MAP framework has really been going through a multi-year approach evolution to improve its process. Last year, we shared with you some of the changes that we anticipate for the next cycle, and in the next few slides, we'll provide with you a refresher on some of those changes, as well as some updates from last year and how we're planning for the future. The current MAP cycle ends in 2024, and we're currently preparing to implement the new framework and new assessments in our upcoming cycle. And here on the slide, you can see in the chart on the left, you'll see the phases of the current cycle. And right now, we're actually in phase 6, which is the action cycle, and we'll soon be shifting to the revised MAP framework on the right side, which you'll see is going to be 3 phases. And so phase 1 is looking at building the community health improvement foundation. And this will start to occur in 2024. Building the foundation involves a starting point assessment of the current community health improvement infrastructure with a strong emphasis on strategic relationships with new and existing partners to determine the readiness and resources available for the MAP process. And after phase 2, which you see consists of the 3 assessments to help tell the community story, we anticipate that NACHO will be releasing finalized guidance on these assessments by 2023, about mid-year in the summer, and we'll get into more details on the following slides. So now in regards to the 3 assessments that are part of phase 2 of the revised MAP process, you'll see here in the Venn diagram at the top is community context, and then to the left you have community status, and to the right the community partners assessment. And the 3 assessments are really shown here in this Venn diagram because all the assessments are really intended to be interconnected to build a fuller picture of the community. And we'll speak about these a little further in detail. And on the right is a roadmap laid out by NACHO for the development of the process. We're currently in fall 2022-2023 phase, and this year, NACHO was able to select 10 communities who pilot tested these assessments, and in July provided feedback to NACHO, and who will be incorporating the feedback before releasing revised guidance for the assessments. The revised guidance will also be accompanied with different webinars and releases of materials, which will help us begin planning for this implementation of the assessments in our communities. So the first assessment that we're really looking at is the Community Partners Assessment, and this will replace the local public health system assessment, which in the past helped us evaluate, how our public health system was doing here in Miami-Dade. And so this assessment will also prompt community partners to assess their own process and systems and understand the degree to which they are addressing or perpetuating any health inequities. And this will include the following domains that you guys see on the pinwheel: health equity and community power, forces of change, policy analysis, as well as resource distribution, community alliances, data access and systems, and leadership and the workforce. And so this assessment will specifically start to have community partners engage and really look critically within their own systems and processes, and also be able to reflect on their role in the community's health and well-being. And lastly, to really understand its degree in addressing health inequities from a range from at the individual level to systemic and structural levels as well. Next up, the community status assessment. This will be able to help us quantitatively describe the community, including many demographics, health status, contributing factors, health equity indicators, and describe existing inequities. These indicators will also be shown over time to describe the changes in the community. This assessment has similarities to our previous community health status assessment, also known as the CHA, and the forces of change. This assessment will emphasize the need to understand root causes and contributing factors. And through our work in health equity and incorporating the social determinants of health in our current assessments and projects, we're well positioned and ready to adapt to this change. And next up, the last assessment we have is the community context. And this really builds on the former community themes and strengths assessment. So if you recall, we had the well-being survey a while back to really capture our community's concerns and their needs, and had also conducted focus groups. And so now NACHO is really looking for us to strive to dig a little deeper to really understand more of the inequities, filling in data gaps, and exploring the context of the community through the lens of those with lived and observed experiences. And specific domains that will be included that it will look at are historical and structural oppression analysis, forces of change, as well as the influence of the built environment, community member strengths, and lived experience. And this assessment also intersects with the community partners one and will highlight how community members may work with partners to co-design and implement solutions. Further, this assessment will explore historical policies, events, and other societal structures that have shaped the community and offer insight into what created the inequities in the first place. So thank you so much. I'll now turn it over to Mrs. Weller, who will provide to us a CHIP strategic priority area update and the current status. Thank you so much.
Thank you, Candace, for that presentation. Good morning again, everyone. I will be providing a broad overview of each strategic priority. Our current Community Health Improvement Plan, also known as the CHIP, started back in 2019 and will be completed in December of 2024. This is our community's 5-year plan for improving community health and quality of life. The CHIP sets our goal for the Miami-Dade County Public Health System, which includes a range of stakeholders such as state and local government agencies, healthcare providers, employers, community groups, universities and schools, nonprofit organizations, and advocacy groups. Our current CHIP has 6 strategic priorities, which include health equity, access to care, chronic disease, maternal and child health, injury, safety, and violence, and communicable diseases and emerging threats. Each block is color-coded and contains the goals set forth in our CHIP. Each goal has specific objectives and measures associated with it, and progress is tracked on a quarterly and annual basis. In the upcoming slides, we will show our progress. Further details regarding the goals, objectives, strategies, and measures can be found in the CHIP and in our CHIP annual progress report. We have also shared the link of the CHIP when you registered and will provide a copy in the chat. This is a graph of the CHIP strategic health priority areas and its completion rates. This graph is color-coded to match the previous slide and reflects the CHIP's completion rates of all 6 health priorities for quarter 1, which includes the period from July 1 of 2022 to September 30th of 2022. Overall, 66% of the CHIP is currently completed as of this quarter. 87% of the objectives have been completed for health equity. 81% of the objectives have been completed for access to care. 44% of the objectives have been completed for chronic disease. 68% of the objectives have been completed for maternal child health. 60% of the objectives have been completed for injury, safety, and violence, and 57% of the objectives have been completed for communicable diseases. The priority area completion rate currently ranges from 41% to 87%. We have had the most success with health equity, largely due to the network of our community partners, contracted providers through the CDC COVID-19 and Health Equity Grant, the Consortium for a Healthier Miami-Dade, and the Health Equity Office Advisory Committee members. We are experiencing the greatest challenge with chronic disease. Some of the challenges we face in this area include time delay in receiving outcomes for surveys and rates of certain diseases. Additionally, chronic diseases are impacted by many external factors. Factors such as natural disasters, pandemics, policy changes, some of which we may not have any control over. While this graph allows us to compare completion rate across categories, it does not show us if we are on track, ahead, or behind where we anticipate our progress to be. This graphic does show us how we are tracking relative to our anticipated completion rate. If a target is completed, this means that the objective targets are currently accomplished. If a target is on track, this means that the objective targets have not been yet accomplished, but progress has been made and is moving in the right direction. If a target is behind, it means that objective targets have not been accomplished yet and or are trending in the wrong direction. It is also important to note that some data is also currently behind in some of the data systems to be able to better assess the current progress of our indicators. For example, Florida charts data is still provisional. If a target is overdue, that means that the objective target and end date has passed and the target has not been met yet. During this section, we will provide a broad level overview of each strategic priority area. We will discuss objectives that have been completed and are on track for being met. We will also discuss objectives that are behind and that have not been met. Each of these areas have specific targets. The goal is by 2024 that we would have reached 100% of our goals met for each strategic priority. As we move forward, if a target is met, that means that the objectives are currently accomplished. This graphic illustration shows us how we are tracking relative to our anticipated completion rate. On this slide, we wanted to share the strategic priority area progress updates for you for this current quarter of July 1, 2022 to September 30th of 2022. Under health equities, the goals under this strategic priority is to ensure that we improve service linkages to encourage equity. We also would like to provide access to quality educational services, improve community involvement, and improve access to affordable and quality housing. Under this strategic priority, we have a total of 13 objectives, with 4 of them being completed, 6 of them that are on track, and 3 of them that are behind. Access to care encompasses all efforts to promote access to comprehensive and quality health care for all Miami-Dade County residents. Access to comprehensive quality healthcare services is important for promoting and maintaining health, preventing and managing disease, and reducing unnecessary disability and premature death, and achieving health equity for all residents. Under this strategic priority, we have a total of 32 objectives, of which 2 have been completed, 23 of them are on track, and 7 of them are behind. The chronic disease priority area is comprised of objectives devoted to reducing chronic disease morbidity and mortality. Heart disease, stroke, type 2 diabetes, cancer, and illnesses related to tobacco use are among the most common health problems affecting people of all ages, socioeconomic statuses, and ethnicities. Risk factors such as a lack of physical activity, poor nutrition, tobacco use, and excessive alcohol use, the environment, and social and economic factors cause much of the illnesses, suffering, and early death related to chronic diseases and conditions. Under this strategic priority, we have a total of 26 objectives, with 9 of them being on track and 17 of them being behind. The maternal child health priority area is focused on objectives to improve health outcomes for both infants and mothers. Differences in health outcomes, such as infant mortality by race and ethnicity, can predict future public health challenges for families, communities, and the healthcare system. Under this strategic priority, we have a total of 15 objectives, with 9 of them being on track and 6 of them being behind. Unintentional injuries such as falls and motor vehicle crashes, and intentional injuries such as intimate partner violence are a major cause of death for people ages 1 to 44. However, most events are predictable and preventable. Under this strategic priority, we have 20 objectives, of which 12 are on track and 8 of them are behind. Emergency response preparations accounts for threats such as infectious diseases, the flu, COVID-19, and natural disasters such as hurricanes. There is also an emphasis on providing culturally and appropriate educational materials to the public. Under this strategic priority, we have a total of 16 objectives, of which 9 of them are on track, 6 of them are behind, and 1 of them is overdue. The State Health Improvement Plan is on a new cycle. They just put out the plan, and it's going to go from 2022 to 2026. Listed here are the 7 priority health issues identified by our state health office. These include mental well-being and substance abuse prevention, chronic diseases and conditions, transmissible and emerging diseases, Alzheimer's and related dementias, injury, safety, and violence, maternal and child health, social and economic conditions that impact health. Inside each box are the subcategories under each priority health issue area. The SHIP is important because our community health improvement plan is informed by and will be in alignment with the state priorities, as well as being shaped by the new MAP process. Another important factor that informs our community health improvement plan and the MAP process are the Healthy People 2020 and 2030 goals. These are the national goals that are set forth by the Office of Disease Prevention and Health Promotion at the U.S. Department of Health and Human Services. Both sets of goals provided over 100 indicators and associated goals to choose from, depending on the needs and priorities of the communities we serve. Our most recent community health assessment, which includes final data from 2020 and 2021, allows us to reflect on the past decade of work and set our sights on the coming decade. In that assessment, we tracked 27 goals and met or exceeded 18 of those goals. The chart to the left shows the 9 goals that were not met. The first column shows the targets set forth by HHS. The center shows our status in 2020, and on the far right, the crosswalk to Healthy People 2030. Goals have been either removed, modified, or retained. Even though it is 2022, we are already looking ahead to the development of the 2025 to 2029 Community Health Improvement Plan. The Mobilizing for Action through Planning and Partnerships cycle begins again in 2024 and contains the three key assessments that Ms. Schottenlauer just went over, which is the community context, the community status, and the community partners assessments. These assessments will give us key insights into what the community needs are. Additionally, the new CHIP must be in alignment with the State Health Improvement Plan, which was just updated and released this year, and the National Healthy People 2030 goals. Armed with this information, we will hold a series of meetings with the community and stakeholders to determine what we need to prioritize and to define specific goals. Your organization's involvement in the MAP process and the community health improvement planning process are key in setting the trajectory for the next 5 years of programming. So if in the course of your work you notice that there's something that needs more attention, more allocation of your time and resources, I would like to recommend at this moment your participation in helping us to build the 2025 Community Health Improvement Plan and by participating in the upcoming MAP cycle so that your voices can be heard. This is where you can make an impact on the next 5-year plan. This now concludes my update on the status of the Community Health Improvement Plan. I will now turn it over to Mrs. Nancy Adebisi, who will provide an update on the progress of health equity in Miami-Dade County. Thank you so much.
Good morning, everyone, and thank you, Mrs. Weller, for those updates regarding the CHIP and the path ahead. Over the past year, the newly established Health Equity Office has been collaborating with key stakeholders to work towards combating health disparities that exist in our communities. Two of the main ways we are doing this is through the formation of the Health Equity Advisory Committee and through funding contracted providers under the Centers for Disease Control and Prevention, COVID-19, and Health Equity Grant. The Health Equity Advisory Committee, formed early this past year, is comprised of partners across multiple sectors who have all come together with a common mission and vision to unify efforts across diverse organizations and disciplines towards a common goal using a collaborative approach to address the root causes of health inequities through policy, systems, and environmental changes with a vision of an optimal quality of life in Miami-Dade County, where health equity is prioritized and root causes are eliminated to improve the well-being and health of the community. This mission and vision were crafted through a collaborative brainstorming process and laid the groundwork for the committee charter and bylaws. The Health Equity Advisory Committee then engaged in a series of conversations and discussions to determine goals to advance health equity. The result of these conversations was a work plan with goals in 5 different areas corresponding to the social determinants of health, which you see here, and subsequently members self-selected into committees to work on these goals. We thank the dedicated members of the committee for their commitment and creativity for building these collaborative goals from the ground up. The Health Equity Office has also been doing significant work under the Centers for Disease Control and Prevention's grant called National Initiative to Address COVID-19 Health Disparities Among Populations at High Risk and Underserved, including racial and ethnic minorities and rural communities. In the logic model on the slide, you can see that we are working under strategic areas 3 and 4. Leveraging the funding we received, as well as the relationships we and our contracted providers have in the community, we have been conducting activities to build, leverage, and expand infrastructure support and mobilize partners and collaborators. With this work, we hope to improve the capacity and services to prevent and control COVID-19 infection, improve testing and contact tracing, but ultimately reduce COVID-19 related health disparities. Make note, we know reducing health disparities in our community is not just about COVID-19, as there are many factors that impact a person's health. The social determinants of health is a lens through which we are approaching existing health disparities. Health outcomes for various populations must be put into context in which we live in, including the neighborhood and built environment, the social and community context, economic situation, education access and quality, and healthcare access and quality. By addressing these domains, we get closer to the root causes of health disparities. Under this grant, we have partnered with 36 organizations to conduct activities within our community, targeting the various social determinants of health. Many projects touch more than one social determinant of health. So you may see your organization or organization's name repeated even though each organization only received one contract. On the following slides, we will go deeper and have a deeper dive into the social determinants of health and the kind of work being done under this grant. To start off with education access and quality, which highlights the connection of education to health and well-being. Through research, it has been shown that people with higher levels of education are more likely to be healthier and live longer. Some of the activities conducted under this domain include implementation of the Engaged Schools model to connect schools to the community and to higher education. This also includes the development of curricula that seeks to improve health literacy and concepts of equity. Next, we have economic stability, which is the connection between financial resources people have and their health. According to Healthy People 2030, in the United States, 1 in 10 people live in poverty. Many people can't afford necessities like healthy foods, healthcare, and affordable housing. Projects under this area are working to provide financial counseling, to provide access to food, provide assistance with seeking employment and benefits. Next, we have social and community context. This domain emphasizes the connection and focuses on helping people get the social support they need in the places where they live, work, learn, and play. Activities under this domain include providing connection to homebound persons to get access to food, creating safer neighborhoods, and connecting faith communities to health education. Next, we have the neighborhood and the built environment domain, which focuses on the connection between where a person lives and their well being. The neighborhoods people live in have a major impact on their health and well being. Many people throughout the United States, and even in Miami-Dade County, live in neighborhoods with high rates of violence, unsafe air or water, or other health and safety risk. It is also important to note racial and ethnic minorities and people with low incomes are more likely to live in places with these risks. Activities in this area include improving street and neighborhood safety through active design guidelines, connecting people to housing resources, and implementing park improvements. Next, we have healthcare access and quality, which highlights the connection between people's access to and understanding of health services. Many people do not receive the healthcare services they need. People without insurance are less likely to have a primary care provider, and they may not be able to afford the healthcare services and medications they need. Activities in this area include connecting people to health resources, such as the development of a healthcare app, conducting health screenings, setting up people with a primary care provider, encouraging healthy eating habits, and so many other activities. Finally, with this slide, you all can see all of our wonderful providers across the map of Miami, showing where this work is being done. Now, I would like to turn it back over to Ms. Candace Schottenlauer, who will share success stories for those indicators with improved performance. Thank you.
Thank you so much, Nancy, for that oversight and overview of what's been going on with the CDC COVID-19 and Health Equity Grant. And now I'm happy to share with all of you a few success stories that we've had over the past year and really resulted in improved and high performance. And so our first success story is Health Equity Objective 2.2.2. And this objective aims to increase the number of engagements with media outlets that will support at least one current health equity effort by collaborating on, distributing, or broadcasting educational materials from 0 to 2 by September 30, 2021. This is the second objective under Health Equity Goal 2, Strategy 2, and is important in providing access to quality educational services. In this strategy, many community partners and DOH programs have worked on and continue to work towards providing educational outreach, media support, and community collaboration for promotion of materials and services that improve health equity and to reduce any barriers of the prevalence of social determinants of health. So now I wanted to share with you all some of the work that's been done. So, through the Consortium for a Healthier Miami-Dade, this past year, we've been able to post 1,215 social media health messages, and these were provided by many partners, also along through our website, Facebook, Instagram, Twitter, as well as our YouTube channel. Also, in the Office of Community Health and Planning, we have the Community Health Action Team, also known as the CHAT team, who provides many educational resources, classes, presentations, and services to prevent chronic diseases and informing the community. And they were able to provide 61,888 health educational brochures and materials and attend a total of 96 health fairs. Up next for this objective, we also wanted to highlight Ending the HIV Epidemic Campaign, also known as EHE, and this campaign was led by local public health officials and partners to address the HIV infection rates in Miami-Dade and raise awareness in our community. The ongoing campaign will continue to target the at risk populations and highly impacted zip codes in Miami-Dade County. The messaging will focus on the three pillars of the Ending the Epidemic plan, which is to prevent, test, and treat. This year's campaign also included traditional and digital media in three different languages, English, Creole, and Spanish, reaching the community at large. Advertisements were placed on trains and stations, as well as buses, also freebie carts in Wynwood and South Beach, and were also shared on various social media platforms such as Facebook, Instagram, Twitter, and dating apps. In addition, there were also radio advertisements as well as TV ads. Next, we have the Optimize Your Health campaign, and through Sunshine Communications, they have been contracted to develop a social media and marketing campaign to heighten awareness about COVID-19, general prevention methods, as well as increasing awareness of health equity and to increase awareness of the Florida Department of Health and Miami-Dade County's efforts to address the diverse needs of the county and its residents. The ongoing campaign is being delivered via social media sites as well as radio and also digitally on a few news times like Miami Times, Caribbean Today, and Univision. And so here you can see on the slide a few of the different campaigns they've been working on throughout this year. Next up, we have for Health Equity 3.3.1. This is another successful objective that is aiming to increase the number of policy, system, or environmental changes in place at Miami-Dade County organizations that support affordable housing, access to healthier food, and increased physical activity opportunities from 2 to 4 by September 30, 2024. This objective falls under Goal 3, Strategy 3, and is really important to improving community involvement. And the strategy to help meet this objective is to support partners in creating opportunities to increase access to adequate nutritious foods, as well as increasing access to physical activity opportunities and supporting affordable housing built environment factors. And for today, I'm going to highlight specifically regarding nutritional aspects as well as physical activity and some of the built environment. So we have many partners and grant contracted providers you just learned about working on increasing access to healthier foods, addressing food insecurity, and providing nutrition education. And so I did want to go ahead and highlight the American Healthy Weight Alliance was established to serve the community with nutrition health education programs and to assist in the development of infrastructures and policy changes for the betterment of underserved communities. They are currently leading the Food Pantry Initiative funded by the CDC COVID-19 and Health Equity Grant in partnership with the Florida Department of Health in Miami-Dade County to reduce food insecurities and chronic diseases that contributed to increased negative health outcomes when exposed to COVID-19. Other partners involved in these efforts also include members of the Health Promotion and Disease Prevention Committee of the Consortium for a Healthier Miami-Dade. We have Buddy System MIA and Food Rescue Us South Florida. Buddy System was also able to help assist with refrigeration at food pantry locations, and Food Rescue Us South Florida has been helping to rescue food for the pantries. And through the consortium's executive board, West Kendall Baptist Hospital will also be working to adding questions related to food insecurity to their patient intake form in 2023. Currently, this year, they focused on adding the PHQ-4 questionnaire for anxiety and depression. This is an example of us moving in the right direction to accomplish this CHIP objective and expanding process and system changes. And now I'll go ahead and share two more success stories related to physical activity. So, a great example of increased physical activity includes the partnership with Miami-Dade Parks Recreation and Open Spaces, the Department of Transportation and Public Works, and A Million Trees Miami with the University of Miami School of Architecture. They were able to conduct a mailer survey which surrounded 6 parks with an overall response rate that they received of 3 to 5%. This was a good rate, and from the surveys, they were able to then conduct interventions at 3 of the surrounding areas at North Trail, Little River, and Kendall Indian Hammocks Park. And you can see on the screen that we're sharing Little River and North Trail Park today with some of the interventions that have been conducted here to include bus stop signage, wayfinding signs, and crosswalks. And they also will continue to conduct drone surveys of the parks to determine park usage as well as monitoring physical activity. Quite an innovative approach. Next up, another great example of a pay-as-see policy system and environmental change that's currently being conducted by the American Center for Architecture and Design. They're currently working to update the Active Design Miami guidelines, which provides guidelines for creating healthier buildings, parks and open spaces, as well as development patterns, transportation, and mobility. Miami-Dade County faces health challenges that can benefit from the use of active design strategies, and this includes rising obesity and chronic disease rates and high rates of depression and other mental health issues. The active design guidelines will also support the health of communities, and most importantly, those that are underserved and were particularly affected by COVID-19. They have also provided outreach to 11 municipalities and provided 6 training sessions for municipality staff regarding the active design guidelines. They also recently just hosted the 2022 Fit City Conference and had a program really focused on housing and the impacts that the social determinants of health play in this role. And lastly, MCAD, the Miami Center for Architecture Design, was able to form an advisory group of 40 plus members from various organizations, including many staff from municipalities, planning directors from transportation departments, and to Parks and Rec. And so this concludes some of the successes that we've seen. And I'll now turn it over to Miss Nancy Adebisi, who will lead our targeted areas for improvement activity for today.
Thank you, Candice. We will now review the targeted areas for improvement and discuss four health equity objectives from the Community Health Improvement Plan that are not meeting the expected benchmark goals. During this session, we will use the Poll Everywhere platform to engage in a deep dive conversation. Please take a few minutes to join us so that you'll be able to participate in the important community conversation. We recommend utilizing your mobile device by either texting in or using the phone's browser. To join via your phone's browser, please scan the QR code on the slide, or you can go to your web browser, which is pollev.com/DOHOCHP213. To join via text, please text the number 22333 with the message DOH OCHP 213. This information has also been included in the chat. If you would like to join via your browser, you can enter or just click on the link in the chat. You can also scan the QR code and access the browser that way. Lastly, if you're unable to sign on and access the Poll Everywhere system, please feel free to include your feedback in the chat box. We'll be sure to make sure to compile our responses from the chat box that we received today. We're going to go ahead and give a couple of minutes for you to join us if you haven't already. As you are signed in, please let us know through the chat box that you are ready for the activity. All right, I see a few responses. Going to give it a few more minutes. And it's so good to see some of our partners. All right. We're going to give it one more minute. And just remember, if you're having any issues accessing Poll Everywhere, you can participate in the chat as well. All right. So it appears that everyone is now within the Poll Everywhere system. So we're going to go ahead and get started. As a reminder, as we go through the activity today, if you're unable to use the Poll Everywhere system, we encourage you to add your feedback into the chat box. We hope that you're able to sign in. And if you're still having issues, don't worry about it. Go ahead and go into the chat box. Now we'll begin our discussion. Today we highlighted four objectives, two that are within the chronic disease priority area and two objectives that are within the maternal child priority area of the CHIP. We want to discuss these objectives in greater detail today so that we can begin to expand the policy, system, environmental change work with all of our community partners here today in order to build more sustainability in our community. So for the first objective within chronic disease 1.39, it reads, by September 30th, 2024, reduce the percentage of youth age 11 to 17 who have used an electronic cigarette or vaping product from 15.2% to 15%. So now we're going to go ahead and go into Poll Everywhere. You should see the question displayed. The first question is, which key community organizations or stakeholders can help achieve this objective? So, in regards to reducing the percentage of youth age 11 to 17 from using vaping devices or electronic cigarettes, which key organizations or stakeholders can help us achieve this objective? All right, and we're starting to get some of our first responses. I have Miami-Dade County Public Schools, seems to be a resounding involvement of our school system. We also have NAMI. So we also have Miami-Dade County Public Schools, the Parent Teacher Association, and youth organizations. Thank you. Sylvester Cancer Center, our school system as well. Okay, definitely. FIU. Okay, they're doing a study within the school system, so that's good to know. So we can definitely involve them within that work. Again, our parent teacher and administration, definitely. Hospitals, definitely. And we also have, in addition to the school systems, physicians and medical providers, Metro Mommy Agency, community-based organizations, definitely. Park systems, definitely. All right. Please be sure if you need to also use the chat, you can. And then Monty will be sharing who has put in responses in the chat. We also have the media, ACS, I'm assuming that's American Cancer Society, SWAT, and health systems. Of course, the Florida Department of Health, Tobacco Prevention and Control Program, and Barry. So definitely our colleges and universities, after school programs, definitely. Boys and Girls Club, yes, definitely. SWAT clubs, all right. PTA, Boys and Girls Club of Miami. Youth programs and parks, okay. DCF, definitely. YMAC. I'm not sure if that was supposed to be YMCA. If so, just put us youth community organizations and agencies funded to work with gang prevention efforts. Definitely. Now, new government center coming to downtown. Okay. Miami-Dade County government to target employees and families. Federation of Families. Great input, everyone. Miami-Dade County Public Schools and the media and park systems, park and recs, social media. Definitely. The library system, thank you for that. Pediatricians, definitely. Okay. So thank you all for this input. It's definitely valuable. All right, and we're going to go on to our next question. What forms of communication or media would you find beneficial to spread awareness about the harms of electronic cigarette or vaping product use? So what forms of communication or media, you can just enter it into the POEV system, text messages, okay, Instagram, TikTok, definitely. So these are forms of social media that our youth are involved in. Social media, of course. TikTok is definitely one, and Instagram as well. Definitely two platforms in which they're on. It appears everyone's agreeing on that. So Google Ads, Facebook and Instagram ads, WhatsApp and text. Okay. Social media, text message, Facebook, TikTok. Okay. Any other forms of media outside of the main social media platforms? Snapchat, yes. TV ads, billboards, and social media, definitely. QR code linking to resources, that's a really good suggestion. Early messaging in elementary school, that is key. Yes, yes, most definitely. Influencers, that's a good one. Influencers on social media and getting them to send out the message. YouTube and Facebook, Snapchat, definitely. Youth testimonials via social media, Facebook, Instagram, or videos on websites. Thank you for that suggestion. Video gaming, that's awesome. Email blast, podcast, news outlet, street campaign, and phone blast. Influencers, we're definitely coming in hot. All right. I love these responses. Thank you all for your input. Live in person outreach and discussions, WhatsApp groups. Okay. Ads on streaming services, definitely. So our music streaming services, as well as our videos. All right. Spot TV message and IG stories. That's a good one. YouTube, definitely. School programs. All right. Social media influencers. Yes. YouTube advertising. Yes. Commercials on TV during prime time. That's definitely going to need the support of partners in terms of funding. Bus stop billboards, Pandora, Spotify ads, definitely. Our streaming, yes, billboards, radio ads, mall electronic boards. That's a really good one. Parent forums, definitely. IG, TikTok, billboards, influencers, yes. Metro billboards, definitely. Grandparents. Oh, wow. That's a really good one. Blogging, and having champions from the school system and local influencers, definitely. Churches and other community social groups, yes. School presenters. Thank you so much for all of this input. And I just love that the input is continuing to flow in. Yes, our streaming services, a celebrity message, podcast. All right. Van wraps. That's a good one. Print ads at local vendors. Okay, thank you all so much for this input in small businesses. We're going to go ahead and go to the next question. And if you had any other additional responses, please be sure to put it in the chat if we were unable to capture it. So the next question is, what community events do you think will be most impactful to host or participate in to conduct outreach to youth about the harms of these products? Outdoor events and youth fair. The youth fair is a really good one. Thank you for that. Fairs in general. Concerts. Yes, that's a big one. Festivals. Santa's Enchanted Forest. That was a good one. Youth sports championships, so definitely football and basketball and all the other sports. Working with HIP, yes. Health Information Project. Back to school events, definitely. State fairs. Yeah, so definitely large community events. The first day of school. Yes, the youth fair. It's a really great event, and sporting events in general throughout the community, and health fairs as well. Also, outdoor events, movie theaters, game rooms. Yes. Movie premieres. That's a really good one. Farmers markets, homecoming. While you have active participation, yes. School and carnivals, main events. Okay. Youth activities at parks, definitely. School sponsored events, definitely. Homecoming, prom, and student breakfasts, definitely, especially for our high school students and middle school students when they have prom. Parent teacher nights and school field trips, movie theaters, definitely. Malls, definitely. When they have mall events, open houses. Thank you all. Well, thank you all for those responses. And we're going to go into this next question. What resources are needed to assist with cessation? So, how can we help those youth that are using these products quit their use of these products? What resources are needed? We have definitely funding is a big piece, and support groups. So, we know within our community, the Bureau of Tobacco Free Florida does have Quit Your Way, which offers free services. But what other cessation services are needed or assistance to help them get that help? So, mental health support staff or support in general for stress release, support for relapses, definitely. Explaining the myths and facts. Yes, we need a youth cessation curriculum, most definitely. We need the help of our elected officials. We need youth peer specialists, parental support and education, changing the perception. Funding is a big piece, yes. Therapy, support at school for addiction. So giving them the care and the access to care that they need, educational materials, and changing the narrative that it's not cool. Yes. Social emotional learning, parental support, funding, curriculums, education for parents. Yes, billboards and radio ads, social educational resources, and safe spaces for healing. So, yes, definitely having that support for those that need it. Peer groups and workshops, educating the community about and decision makers about the epidemic, definitely, and support on peer pressure. Thank you. This is a really great input. All right. Family support of teens who learn the behavior and parents and stop punitive punishments. All right. Thank you all for your input for this question. We have our next objective, which also falls in regards to vaping use. Chronic disease 1.310, which reads September 30th, 2024, reduce the percentage of adults over age 18 who have used electronic cigarette or vaping product from 2.3 to 2.1. So we're going to go ahead and have the questions as well for this. We're going to go ahead and show our first question, which is what forms of communication or media would you find beneficial to spread awareness to adults in regards to the harms of electronic cigarette or vaping product use? So, very similar to our youth, but what communications or media in particular are needed to reach adults? If you can just place your responses in the poll everywhere. So, college clubs for our young adults, Facebook, outreaches and awareness, definitely. Same as mentioned before, but more focused. Online newspaper, job ads, LinkedIn. That's a really good one. Radio, YouTube, podcast, TV, in person outreach. Yes, some more focused. Grocery store, school uniform stores, and gas stations. Popular podcasts, on job support groups, social media, specifically Facebook. So we know we find more of our adults on Facebook, definitely. Short but informative in all platforms, definitely. So really informative and impactful information. Gas stations, newspapers, news stories, and trending news. Facebook ads, social media, local food stores. Short ads on the colleges, nightclubs, and beach areas. Google news stations and text. Ads on major sites used, definitely. Posters in local nightclubs and bars. Spot TV message. All right. Also including in buses and billboards in grocery stores. Billboards. Any other forms of communication or media? Corner stores. Okay, definitely. All right. Thank you so much for your input. We're going to go to the next question. Also, universities and health counselors. For the next question, we have what community events do you think would be most impactful to host or participate in to conduct outreach to adults about the harms of electronic cigarette or vaping product use? So, what events or activities within the community should we target to do outreach specifically to adults for this issue? Same as previously mentioned, definitely. And we'll take from the other question. Concerts and large festivals, definitely. Job fairs, it's a really good one. Farmers markets, sports events, faith-based gatherings, it's a really good one. Sports venues, children's trust family expos. Thank you for that. Blood drives, hospitals, gyms, urgent care clinics, school orientations for high schools and universities. Any specific community events, federally qualified health centers, definitely. Planned Parenthood community events, health fairs, state fairs, WIC events, definitely working with our sister program, corporate runs. It's a really good one. Immunization and testing sites, events hosted by the city and county, definitely social media, supermarkets, billboards, food and wine festivals. I'm assuming it's supposed to be Calle Ocho, maybe spelled correct. Had a part in that. The DMV, yes, Calle Ocho. Okay. Health fairs and festivals and jazz festivals, pharmacies, Miami-Dade County Library events, definitely. Pharmacies, barbershops, restaurants, and cultural events. Awesome. Community forums, definitely another good one. And brunch venues, beauty malls, okay. Parades. I love the creativity here, laundromats. So definitely reaching the people where they are. Miami Beach Pride, hair salons, town halls. So we're definitely meet the people where they are. I love it. Mall events, Marathon Expo, Gulfstream. Okay. Send along with utility bills. All right. I'm not sure if we can do that, but that's definitely a creative one. Thank you all for your input with this question. All right. So the next question we have is what resources are needed to assist with cessation? So as you know, we do have free cessation available within our state, but what resources are needed to assist with cessation? So definitely peer support, funding, on the job support, financial support, or mental health therapy. Okay. How to cope with cravings? A warm line. So free assessment and various cessation treatments, SWAT groups, streamlined processes. So in this case, I'm assuming avoiding silos and working together. Support groups, support from family members, multi-language literature. Yes, definitely. So we definitely need help with that. Media attention, working with local programs and officials. I'm assuming it was to increase the tax, repeated promotion of free resources, making that information available at pharmacies and doctors' offices, times of service after regular working hours. Yes, for those especially who work throughout the day. Funding, education on the various methods of smoking cessation, So I'm assuming templates to share to encourage those who want to try to quit. Okay. Anonymous programs. Okay. Thank you so much for this input. Continue partnership with AHEC. So definitely our partnership with the area health education centers and retreats. Okay. So we're going to go ahead and go to the next question. The next question reads, are there any barriers to access cessation resources in the communities that you serve? So thinking about the communities that in which you either reside in or serve, are there any barriers to those who want to quit to access these cessation resources? So definitely we have financial barriers or the commute, knowledge of what the resources are. That's a big one. Language barriers, lack of knowledge, lack of resources. In this case, youth are unable to receive nicotine replacement therapy, no centralized location for resources, lack of understanding, lack of knowledge and distance to services, no support system, lack of information, social norms for youth making vaping something normal and acceptable, usually very little in Creole. Okay, thank you for that input. And lack of knowledge or ability to get these resources. Okay. So we are going to go into the next question. We do have a few more coming in, and those will be captured. So the next question deals with maternal child health, and it reads, by September 30th, 2024, we'll work to reduce the Black infant mortality rate in Miami-Dade from 10.8 to 10 per 1,000 live births. So for that first question, for this respective objective, which key community organizations or stakeholders can help achieve this objective? So which organizations and stakeholders can help us in reducing the rate of maternal deaths within our community? Hospitals, definitely including that within their community health needs assessment and implementation plans. Healthy Start, hospitals, definitely. Doula organizations, definitely. Healthy Start. OBGYN practices, faith-based organizations, daycares, the Healthy Baby Task Force, definitely. So the objective is um, by September 30th, 2024, reduce the rate of maternal deaths, better access to midwives, food banks, and community health centers, Miami-Dade County Head Start and Ellie Head Start, Jasmine Project, local municipalities, WIC, definitely, doctor's offices, definitely. And thank you all for your input and your participation. Metro Mommy Agency, ICU Baby, definitely. Local universities, Southern Birth Justice Network, and some of them are our contracted providers, so we're glad to see them listed here. Federally qualified health centers, prenatal care, midwives, shelters that serve women, March of Dimes, definitely. Government officials and officers, definitely spreading that information. Midwife midwives and their networks, nursing associations, Breastfeed Miami, Preconception health is key, most definitely. Doulas, physicians. All right, childbirth education instructors. WIC, definitely. Churches, temples, synagogues, and religious organizations and doctor associations. Miami-Dade County Medical Association. Nurse practitioners. Definitely, it needs to be a concerted effort. ACOG and community clinics. Thank you so much for all of this input. We definitely need early messaging um, to work to reduce racism. Definitely. Thank you all for your input. For the next question for this area, we have from the partners identified in the previous question, how could we work together to break down our silos? So, how can we work in partnership and collaboration? How do we break down those silos? Collaborate on funding opportunities. Acknowledge that there is a problem. Put egos aside and share the work. Host a maternal child health community meeting. Meet regularly and support each other's meetings. Community forums. Acknowledge the hardship. Expand involvement in consortium or make consortium meetings more specific, addressing some of these issues. Communication. Conduct a SWOT analysis to see how the relationship can improve. Use the same tools to monitor and treat. Ask birthing facilities to work together to address these needs, working within coalitions. So definitely we have our Healthy Baby Task Force, shared membership, look at the root cause issues and develop appropriate interventions. Convene a Miami-Dade Maternal Health Summit with actionable goals to be achieved by the end of the summit, including commitments by participants. So definitely that is actually how our Healthy Baby Task Force was formed. So we definitely encourage you all to participate in the consortium, but we can definitely work together to make actionable goals. Acknowledge bias and how we can move forward. Meet quarterly to exchange updates, staff changes, new initiatives, etc. All right. Thank you all for that input. Show up to meetings and voice your thoughts. All right. So we're going to go on to the next question. What factors or specific examples of social determinants of health do you know of that are contributing to the increase of Black infant mortality rate in Miami-Dade? So, what factors? Stress, that's a big one. Housing, lack of support, food insecurity, low income and low wages, economic stability, lack of transportation to visits. I see in the chat we also have unemployment, affordable housing, access to healthcare, lack of resources, capacity issues like lack of staffing to put required actions into place, limited access to education, implicit bias in medical professionals, access to healthy nutrition, transportation, lack of access to care, built environment, affordable transportation, walkability and safety, neighborhood safety. So really touching on our social determinants of health and health disparities, mental health, trust in the healthcare system, generational trauma, lack of insurance or fear of high costs, staff dealing with social determinant of health issues of their own, Doctors being dismissive of concerns for birthing persons of color, not addressing root causes such as systemic racism, racism and bias, quality healthcare providers, access to high quality healthcare, race, connected communities, appropriate referral resources, health literacy. Definitely all providing meaningful information, and we thank you for your input. We're going to go ahead and go into our last portion, which is to reduce the rate of maternal deaths from 12.9 to 12. Um, what ongoing or new initiatives would help us support the reduction of maternal deaths in Miami-Dade? What initiatives are currently going on or new initiatives that have just started that can help support the reduction of maternal deaths? So we have incorporating doula support, listen to mothers and their needs, MomCha program. Are there any new programs or initiatives or programs or initiatives that are currently in place that we should know of? WIC's breastfeeding program, definitely. Healthy Baby Task Force. I see in the chat we have FEMUR. Black Mothers Care Plan, Healthy Start. The Jasmine Project. All right. Thank you so much for that. Definitely working on the social determinants of health, specifically with food insecurity and postpartum mental health condition awareness screenings. We have FEMUR. Thank you all for that input. And Healthy Corner Stores, that's a really good one. Um, we're going to go into the next question. How can we motivate partners or organizations to implement PSEs or policy systems of environmental changes related to maternal health? And how can we track these PSEs? So we did had funding, a point system, policy changes, reaching out to organizations, incentives, lunch and learns, interactive transitional training, show the value that it and how it relates to its mission, share the impact of policies and how they improve our community, showing them how easy it is to get involved and track through surveys, funding, increasing awareness. Definitely. Funding as well. Funding is very important to support and maintain. All right. Appears that we have slowed down on our responses. In the chat, we have advising mothers of their rights before giving birth. I'm not sure if that was for the previous question. Integrating sustainability plans and collaboration amongst all organizations that provide service to the area. Thank you for that. We're going to go ahead, public-private partnerships. Thank you so much. So we thank you all for the feedback that you shared today in our conversation. This information will be used to update our CHIP annual report that evaluates the current status and process that we have been making it within our community. Additionally, the responses shared today will also help shape some of the work that the Consortium for a Healthier Miami-Dade and Health Equity Advisory Committee will work on to accomplish health equity in Miami-Dade County. Thank you all so much for participating in this important conversation. I will now turn it over to Ms. Jessica Mulroy, who will share some next steps on the MAP process as it relates to further development of the CHIP and other health equity office updates. Thank you.
Thank you, Nancy. I'm going to very quickly go through our next steps and review what's ahead. So looking ahead to the future, we still have much work to do in our current CHIP strategic priority areas as we are still in progress on the majority of our goals. The current cycle will end in 2024, so we are over halfway through the timeframe set out by the CHIP, and we're well on our way to accomplishing these goals. You should be proud of the hard work accomplished to date. Though we are still a few years out for the beginning of the next CHIP cycle, we've been planning and thinking ahead. The updated assessments and guidance to be released by NACCHO will guide our process, while the strategic priorities set out by the state and the recently released State Health Improvement Plan will inform our strategic priorities. The metrics and goals set forth by Healthy People 2030 will aid us in selecting goal metrics under each strategic priority, and most importantly, the input that you, our community, our collaborative partners will give us sets the course for the next 5-year cycle. Finally, we'll be continuing to carry out health equity activities under our CDC COVID-19 and Health Equity Grant and to support the 36 contracted providers in the projects under this grant. The Health Equity Office will continue to work to advance health equity in community health planning, and the newly formed Health Equity Advisory Committee will begin in earnest to leverage their expertise to come together to achieve their work plan goals. This is an exciting future to play a part in building, and we thank you all for your hard work in advancing and achieving that. And next, for evaluation, please take a moment to scan the QR code or follow the link in the chat to complete the meeting evaluation survey. We use these responses to help inform our planning for next year's annual meeting, and we appreciate you taking the moment to assist us. And with that, we'd like to thank you for attending this meeting and being part of the process of making Miami-Dade a better, healthier, more equitable place to live, and Florida the healthiest state in the nation.